Welcome back. We've seen the province increase the scope of practice for nurse practitioners and pharmacists in the province. Now, psychologists say they're frustrated about not being able to practice to full scope. We're going to talk about this right now on Get Psyched with Dr. Janine Hubbard. Dr. Hubbard.
Good evening, and thank you for letting me cover this topic that's near and dear to me. So the good news is, unlike, say, the case of the pharmacists or the nurse practitioners, where it's really affecting kind of what's in their license to practice, what we've been seeing is psychologists within the public sector positions, so healthcare, education, post-secondary, say that they are leaving those positions because they're not able to practice to their full scope. And the best example I can give is very much like a physician. You might see a physician in a walk-in clinic, you might go for a specialized test or an assessment, or you might have your family physician who you see on an ongoing basis. Psychologists very much practice in a variety of situations like that, be it assessment, which can be very time-consuming, it may be one-time consult, or it could be long-term therapy with a client.
Now, we all know it's very difficult to find a psychologist in the province. Is this issue contributing to the problem?
Oh, there's no question. That is actually one of the top reasons our psychologists are giving us why they have left the public sector to go into private, where they have much more autonomy and the ability to practice to scope. So a lot of people ask, well, like, why is this so important? Partly it's in terms of job satisfaction, but it's in meeting the needs of our clients. And sometimes that is a single session, but for many it requires much longer term interventions. In fact, there's a lot of research that shows for common psychological common psychological conditions, 10 to 20 sessions is what the research shows is recommended. And on one hand it sounds obvious, but people don't often think about it. Therapy is hard. Therapy involves gaining trust with someone. It involves telling your story and making yourself very vulnerable, talking about things about yourself that maybe you're not so proud of or you're ashamed of. It makes it challenging if you are constantly having to see a different clinician, or there's a turnover in clinicians, or you're being offered single session. In fact, many people have talked about it being re-traumatizing, and it's often a reason why they don't go back to therapy, is because trying to tell their story over and over again and just find that connection and feel safe is something that the system is not providing to many people at the moment.
Dr. Hubbard, thanks so much for this, and we'll see you next week.
Thanks so much, Dave.